I'm joined by my friend Richard. Hello, the good doctor, sir.
Well, that's a very very nice entrance. Far beyond what I deserve, but good to speak again.
I see. I like to make you smile. So I like your smile. It makes me feel better about the world.
Very good.
Now we talk about all things involved in medicine. Now I was having a little bit of fun at your expense because you say medicine and I say medicine, and I wondered. So I'm going to ask you this very, very bravely: Is reducing a syllable in the word medicine, is that why doctors' handwriting gets so bad?
Well, I'd never thought of that, but maybe you're right.
He struck me the other day, and I thought, well, I'll be honest with you, just in case you weren't listening to that. But I just think it because I now say medicine. I never say medicine.
Well, I've not thought. You've now made me think about it. It was automatic until about 10 seconds ago.
Well, these little things, they come and they make my little brain think, huh, what was that about? I don't know. It's interesting. Now, we talk about all thing medicine related topics in the news. What's going on, and sometimes undoing some of the complications around a subject. We recently spoke on vaping. Is it good? Is it bad? Is it really good? Is it really bad? And we try to unpick some of the. Well, you do that bit. I just sit and happily enjoy it. But we try to think, well, is it really better? Is it really? So we try and get into the reality of it, because the thing is, in anything that's out in the journalists' world, in papers, in the news, whatever, there's always spin on it somewhere, because somebody somewhere wants something to happen, and that's always going to spin it. Which is why so many I've recently reading so many medical studies that were highlighted as, by the way, you do realize that this, they're all paid for by the people who are making the drugs. And shockingly, look at what the research states. Now, that's not to say it's all false, because some of that research is really valuable, but we do need to question the source of the money
Yes.
for the research.
Yes. And which is why whenever we look at the Bible, we should always look at the context. Who's Jesus talking to and why? We know if it's Jesus talking, it's going to be correct. But you need to think about what you're reading. Absolutely. And I think as Christians, we've had some extra help along the way.
Yes, critical thinking, the one thing that schools should be teaching and never do.
Indeed. Well, maybe in these days of fake news, it's going to have to be taught. How can you evaluate what you read?
Yeah, absolutely true. So where are we going today then, Richard?
Well, yeah, topical, absolutely. Usually we talk about a disease that I've had some sort of experience of, or at least come across patients with it. So that covers caffeine, vaping. We've just talked about stopping smoking, cold dipping, or even most recently ketamine. Because I'd had an addict to ketamine and all the problems he'd had, and then suddenly it was in the news. Well, today's a bit different in that I've got no experience of this one at all. It's a virus in the news, hantavirus. You may or may not have come across, Andy, but this virus hitting people on the cruise ship, including some Brits. So I was thinking, okay, here's three questions immediately that strike me. Number one, what exactly is it? Number two, what dangers does it pose? And number three, is this potentially another COVID? Or is it something much more localized and minor? So, time to do a bit of research. And in fact, there was an article in today's Times. I don't get the newspaper every day, but I did today. And there it was in today's Times. Talks about the cruise ship at the center of this hantavirus outbreak. And there'd been a cluster of infections on the ship, particularly after the ship had visited Argentina. And more particularly, a landfill site whilst they were bird watching. And thus far, sadly, three passengers have died, a Dutch couple and a German, and five other confirmed cases and three suspected cases, according to the WHO. From the UK point of view, one of the crew was a British wildlife photographer who was extremely unwell, in critical condition, now beginning to improve. He's been medically evacuated to Holland. Two other Brits have returned home and told to self-isolate, oh dear, for up to 6 weeks. Ouch. That's nasty. The rest, 100 or so, will be repatriated via Tenerife to Spain. Seems to be. Anyway, officials are playing down the risk of the wider disease, according to this article. So playing down the risk of it spreading to the general public. So here's a few questions, and I want to answer them really. How did they catch the disease? Well, the article at the moment just tells us that this landfill site, almost certainly because of its nature, will have had rodents, rats in particular, and the disease is normally passed to humans via rodent feces, urine, or even saliva. hence a bite. Also thought to be there's thought to be a human strain of the disease, and this is relevant in South America particularly, i.e., it's passing between people, not just from rats to people. So that's the article in today's paper. Let's look up a bit more on the science. So hantaviruses are a group of viruses, not just one. They're a group of viruses naturally carried by rodents long term without affecting the animals themselves, but which occasionally infect humans. Now, there's a flash word for this: zoonosis, ZOONOSIS, and a disease which we can catch from animals, and they tend to be vertebrate animals, an infectious disease carried by vertebrates, which can infect humans. Going back to the bubonic plague from rats, classic Lyme disease from ticks, Ebola, COVID, now thought to be from civet cats in particular. The critical thing is close contact between the animals and the humans, as in the COVID story. In other words, if we encroach enough on animals' environment, or to be fair, if we make a landfill site and I guess they encroach on ours, this is what can happen. And the thing about hantavirus, it's very rare, but if you get it, it can be very severe. Now, this is really interesting. The type of illness depends not only on which hantavirus you get, because it's a group of viruses, but the location geographically. So before we look at those locations, how do you start feeling? How might you have the disease? Well, no wonder they found it difficult to diagnose. It's basically a mild flu-like illness, as COVID is. 1 to 8 weeks after exposure to the rodent material, fever, headache, muscle aching, nausea, vomiting, abdo pain, GI symptoms. How many diseases cause these minor flu-like symptoms? But there are 3 types which are particularly nasty. In the Americas, you get what's called hantavirus cardiopulmonary syndrome, which is a severe respiratory illness, cough, shortness of breath, fluid in the lungs, and shock, death in up to 50%. We're talking a really severe illness here. Europe and Asia, you get a hemorrhagic fever with renal syndrome. So it hits the kidneys particularly, low blood pressure, bleeding disorders, renal failure. So a different picture in Europe and Asia. And now, this one I mentioned earlier, in South America, you've got a type which seems to cross between humans. And this is obviously in relation to this cruise ship. Treatment, there isn't any at the moment for the virus, except what we call supportive treatment, dialysis for renal failure, ventilation for respiratory failure. So that supportive treatment is the treatment. Prevention, well, don't come into contact with infected rodents. That's clearly it. So you have to avoid the cause. Frequency, well, I hadn't realized this, is already up to 100,000 a year worldwide, especially in China and Korea. Around 1,000 a year in America, small numbers in South America, but again, as I mentioned earlier, small numbers, but very serious if you get it. Diagnosis, as I mentioned again earlier, very difficult because the symptoms are just a mild flu illness. It could be flu, it could be COVID, could be dengue, could be sepsis, could be viral pneumonia. So what you have to get, and this is where the history comes in, any exposure potentially to rodents. Where have you traveled? So your travel history. Have you particularly been to areas where hantavirus is known to be present? Now, lab tests can pick it up, because I was thinking in the paper, okay, how do you diagnose this? Well, you look for hantavirus-specific IgM antibodies or rising IgG, 2 types of antibodies. And then if you go a bit further, you can even detect viral RNA in the blood. Risks to the public, very low. Cases need prompt isolation, infection control, hand hygiene, handle body fluids safely. So just as a quick summary before I bring you in, Andy, it's bad, but it's rare. It tends to be isolated, very unlikely that we're talking about another COVID here. And by the way, cruise ships are dangerous. I mean, if you get a nasty, just a common things being common, I don't know, Campylobacter diarrhea, even Shigella diarrhea on a cruise ship, you're in the middle of nowhere and boy, will it spread. I guess here's another thing where cruise ships have been. Yeah, I think it's slightly put me off cruises. There we go. Over to you.
Yeah, I never done a cruise. I guess the closest I came was going from Harwich to Denmark, which was I think a couple of 3 days or something. It's not very far. It's not a cruise. It's just it's a long ferry ride. But yeah, I suppose cruise ships in our heads is that way you can isolate easily. Everyone's got their own cabin, their own toilet and bathroom. Great, just isolate everybody. But it doesn't work that way in reality.
Well, also the food has to come from somewhere. Say there was a problem with rodents getting into the kitchen, it can affect everybody through the food, or potentially everybody through the food. So yes, yeah, interesting. So it's a virus I'd very, very vaguely heard of until the recent outbreak, and now it brings it to people's minds. And but I think this bigger picture of sort of coming together with unhelpful animals as a result of the human population expanding, us entering their environments, perhaps they enter our environment. Yeah, it's zoonoses are increasingly common, and this is where a lot of clever scientists are doing work because they know that COVID's not the last virus that's going to cause a COVID-like problem. I don't think it's going to be hantavirus from what I'm reading here, but it could be another one.
Now, I have worked on a domestic waste site up in Scotland. I might even mention that. I had special shoes that were basically steel plated around the bottom. We had two sets of overalls, one over the top of the other. So we were pretty well protected. Our hands were in at least two pairs of gloves at all times. You always work in twos, and you don't start messing around with anything that's flying around you. It was quite serious. I had to sign a disclaimer before I went to do it because there's all sorts of nasty bugs. Hence the rather special Wellington boots we had to wear. You don't eat during a day. You don't eat during a shift. You just don't ever. You eat before you get on, and you when you finish. We managed to find a way of using packeted food, so you didn't have to get completely unkitted in order to have a bit of lunch. But you're talking about a packet of crisps because you can open that without touching it and eat it. So you find ways of doing it fairly safely, but. Well, I suppose I've worked on a site. I know the risks of bits of shards of metal. I mean, if you're going to cut yourself, just go to hospital, book a room for the next year, and you'll get sorted. Why on earth were they on a waste dump? That's the bit that terrifies me.
Wasn't in the article. I looked at it several times. Exactly. You're on a bird watching expedition. Why are you going to a landfill site? I've no idea. And the article didn't tell me. It's strange. I agree. Very strange. I don't know why. It didn't fit together. No logic behind it at all, as far as I can see.
I mean, forget the geography for a moment. You're not going to get the lesser spotted condor on a waste site. It's why? And then if you're going to go to it, I mean, literally, we were kitted up so much. When you get off the site, everything has to be spotlessly clean before you're allowed onto the roads again. And there's so many checks now. Okay, Argentina perhaps they haven't got the same standards of health and safety that we do over here. Some of that's good, some of that's bad. But we took so many precautions working on a waste site. But I have in my mind, I have them in their sandals and shorts with a camera walking across a waste site, and it terrifies me.
You're potentially correct. I just don't. I wish the article would give me more information, and maybe subsequent ones will. But why are you on a landfill? Why would you visit a landfill site in Argentina? Unless you're a specialist looking into landfill, wearing all the kit. I don't know. Very odd.
I mean, they stink.
Yes.
Let's make no bones. I have worked in a landfill drilling through 25-year-old waste in Edinburgh. The smell is something that your stinky kitchen bin does not even reach the same universe of smell. So everything about that environment is saying go away. Don't enter until you absolutely must. We were drilling pipes for methane so the thing didn't explode. So, rather important. But bird watching, could you not get a bigger telescope?
I think we just need to keep an eye out for the news because that was very strange. I mean, even if I'd been writing the article, I'd have probably said, hang on, why are they there, even in the article? And then say, well, I haven't got an answer, but there we are. That's what's happened. It was just one line and then they carry on. Hang on, there's a disconnect here. There we are. Very strange.
Yeah. It's the one question I want to know because it's the curiosity in most humans of, but why? It's like I walked into a wall. Okay, that's great. Why? Why did you do that? It's the why that matters more than the what. Because if you can deal with the why, the what doesn't happen.
Yeah, absolutely. Well, there we are. I've learned something because I didn't know that you'd worked on a landfill site. So there we go. I was going to use a terrible. I was going to say I flushed you out, but that may not be the best way of putting it.
Let's just say stinky bins were not a problem for a good 5 or 6 years after that. I never ever had a problem ever again. Now, 8 weeks. This is the other problem of how illnesses spread. If you, I don't know, the easy one. If you break your leg, you're going to have to stop what you're doing. You've got to seek medical help. You're going to have a cast. It's very obvious. That's a breaking of a limb. If you have hay fever within 24 hours of walking through a pollinating field, you're going to be struggling with your breathing because of it. 8 weeks to start to show symptoms. I mean, that is there anything else that long before it reveals itself?
A very long time, because the classic sort of coughs and colds take 7 to 10 days, because the virus has to replicate inside your cells to a sufficient amount to begin to cause trouble. So 1 week to 8 weeks, well, the 1 week I get, even the 2 weeks, potentially the three, but the eight is very odd. I suspect that's because we haven't got enough data to drill it down a bit further. So yes, 8 weeks is very strange, unless you just get some sort of tiny viral input, which takes longer to replicate. But bear in mind how fast viruses replicate. Immensely fast, usually. Yeah. So yes, 8 weeks seems very strange. 1, 2, 3 weeks, much more common.
But also, presumably, the 8 weeks is a bit of a misnomer, because if they're on a cruise ship and they're now dying, that's not 8 weeks on a ship. So presumably, in real terms, yes, it can be 8 weeks, but probably just a few days, because they're already dead, some of these folk.
Probably the 8 weeks reflects the fact that they don't actually know what day they visited the site. Now, in this case, we do know what day, but maybe 8 weeks elsewhere, because the 8 weeks refers to the bigger picture. Perhaps people simply didn't know at what point they caught the disease. I guess that's it.
No, I think, again, I'm interested in the why. Like, why 8 weeks? Because it interests me. 100,000 people a year. I had never heard of this virus before. I mean, I'm not surprised. I'm not a doctor, a scientist. I mean, I'm not surprised by that. I'm surprised you hadn't heard of it. But 100,000 cases a year, it's a hard question to ask. Whereabouts in the scale of illness is that? Because that to me sounds tragically high, but it sounds quite low in terms of an annual thing.
Low. I mean, I had heard of the virus. I wasn't aware of its extent. No, 100,000 a year is not high. No, I mean it's tiny compared to, I don't know, TB or malaria, where you're talking hundreds of millions per year affected, and 1 to 2 million dying. It's small fry numerically. It's just what's most interesting about it, a bit like rabies. Yeah, it's not that common, but boy, do you not want to get it, because it's very severe when you do get it. So in fact, rabies is universally severe if you get it without treatment. It's that effective a virus. So it's an interesting condition. 100,000 a year is it's still a number, but in terms of other diseases, it remains very small.
I think the reason why I asked that is it helps us to assess how serious is this. And if it's 100,000 people a year against hundreds of millions for TB malaria, then it does help us to be in context. Okay, this isn't great, but let's not panic.
Yeah, absolutely. Yeah, that's right.
Now, other elements of this, which I just find fascinating, I want to come back. Maybe a crew can do cruise ship illnesses. Why cruise ships are bad for you? We're not going to do that one because we get sued for that one. But I just find it fascinating that it's such a breeding ground for illness so rapidly. I mean, I'm guessing, I don't even know how big the ship is. I think I saw a picture. It's not enormous. It's not a 10,000 strong Disney ship. So it's not that kind of size. But obviously there's enough people. I read a bit about rodents, and of course my brain straight away goes to either bubonic plague, which was rats was my first place I go to, but also rabies was the other one of illnesses that can transmit from both, because I was reading about stoats. I saw a stoat recently and I thought, oh, was that a stoat? I googled it. Yes, that's what it looks like. And then it said, by the way, basically many stoats in the UK can carry rabies, which I didn't know. And it's one of those diseases which can transfer.
Well, that's interesting. I didn't know that about stoats. Certainly, I mean, rabies is. I've seen a rabid dog in Nepal being stoned to death by the locals. Which was very, very sad. In fact, they didn't need to stone it to death. The poor thing will die in 10 days anyway, but that's what they chose to do. So it obviously didn't bite anybody in between. And vampire bats are classic for rabies. I wasn't aware about stoats. That's a new one for me. Animals can be dangerous to us. There's no doubt. I'll have to look up stoats and rabies. You've got me on that one. How interesting.
It was just fascinating because I don't know. I don't remember seeing one for many years. I don't have any memory of it. And driving along the road, one of them just went across the road, and I thought, well, it's definitely not a rat. It doesn't look like that. It's browns and whites. So we looked it up and thought, okay, that's exactly what we saw. But it did say a thing, just be cautious of them because they are predators at the end of the day. Might be small predators, they're still predators.
Yeah, I remember watching a stoat on one of these wildlife programs chasing a rabbit many times its size. And eventually it ran the rabbit down and simply got up and bit its neck and then took it home. they are very, very strong, effective at what they do. Tiny things, size of a small cat, very small cat. But boy, have they got sharp teeth, and boy, can they bite. Yes.
Yes, and I think this is one of the things that we need to be cautious of. When we're talking about animal kingdom, I know there are lots of animals out there, and especially in the UK, we have hamsters as pets and we have cats as pets, and they're fluffy little squishy things. By the way, they hurt you. But actually, we tend not to think about going abroad where they have slightly more dangerous animals. I'm not talking about bears and lions. I'm just talking about, rats that are larger and less controlled. It gets more dangerous.
That's absolutely right. Yeah.
And we've got to respect the animal kingdom.
I think we do. That's right. And we may be placed over it, which we are by God, but we do have to respect the kingdom. And yes, certainly, I think the obvious things, the big boys, the sharks, the lions, and the bears, we do respect those. But yeah, just respect the smaller ones too.
Yes, I remember we had gerbils. I don't know where the gerbils came from. They're vicious little things. And I had quite a severe laceration as it tried to attack my hand. Went to hospital. I just put some plasters on. It wasn't as bad as it looked. One of my family had a tiny, teeny little scratch. Have you had your tetanus recently? No, I'm fine. And okay, bend over, tetanus time. Because we need to respect the animals that are around us, and even the humble little tiny gerbil, which is very vicious, it can cause us great problems. And if we don't respect a scratch, I mean, the obvious one is, okay, you scratch yourself with a rusty nail. I fell down recently and cut my leg on some stones. There's no metal in there. I'm not worried. If there's been metal in there, you can guarantee I would not have just come straight home, because we respect metal and rust, because by now we know, well, tetanus, really severe. But yeah, I can't help but ask a question again, which I know you haven't got the answer to. Is what on earth were they doing on a waste site taking photos?
Yeah. No, indeed. I simply don't know. Were they looking for a vulture? Who knows what they were looking for? But I think there won't be many cruise ships going to waste landfill sites in the near future. That's the only good thing.
But it does pose another interesting question just before we finish, because sometimes our hobbies or our interests, we can get into them, and we need to be cautious of them. Now, I think scuba diving is one of those where you have to be very careful about air travel if you've gone down, and it can be dangerous to you. And so you might respect that. But actually, the things we do, the hobbies as people, it's great to learn about nature and to immerse yourself and go and watch a bird or whatever you want to do. But we do need to remember we're people, and we're quite fragile and delicate as human beings, aren't we?
Fragile and delicate. We're nothing like as tough as animals themselves. Absolutely right.
I don't know if you saw this. There's a silverback gorilla somewhere, and it's got a rope through the window, and you can pull against the rope against the gorilla, and if it's playing, it'll pull back. And there were these 6 enormous, massive, muscular men just whacked into the glass pretty much by this gorilla going, yeah, don't want you. We've got to remember how strong these things are.
Wow, I haven't seen that, but I can imagine. I certainly read that an adult male chimp is 6 times as strong as the adult human. And they're also very vicious. That's why nobody ever goes into a cage with a live chimp, because far stronger than you are and nasty. So yes, these are serious animals.
Yeah, but it just comes back to the hobbies and things how we spend our leisure time. Are we doing it because we want to do it? Everything in me. Okay, today's excursion, we're going to go to a waste site. I'm going to be saying, do you know what? No. Because I don't know about this particular virus, but you know what? It's a household waste site. It's an industrial waste site. I don't want to go there. You got smells, you got cuts, you got all sorts of nasties. And it does make me think about, I suppose, the selfishness of mankind generally. I want to go here. I want to do that. Well, maybe you should be thinking twice, especially if the words it's a waste site is in the sentence.
Isn't there? Well, yes, I'm interested to see. To see if there's any more comeback on why did they visit a landfill site, and B, whether organisations will factor that in the future.
One would hope, very much hope, that they'll be saying, yeah, maybe that's not a great destination. We were in Spain. Let's go to Gibraltar. It was a day trip. There was no talk of dying on that. We were on a coach. We went to the thing. We went in to see some dolphins. It was all fairly, nondescript, but. Yeah, maybe keep waste sites away from you. our top tip. If you've got any questions for Richard or any thoughts on this one, you can let me know. But yes, we'll be back again for more in the future as ever. If you've got a question or a topic you want to let us know about, you can do. We get the odd question, which is great. Hello at pure247radio.org. Hello at pure247radio.org. Dr. Richard Scott, my friend, thank you, sir.
Andy, always a pleasure.
Pure Men's Mag is under starter's orders and raring to go. Yes, the June edition even still has that minty fresh smell of anticipation as the amazing team make sure everything is tickety-boo just for you. We take a moment to focus on Dave Kingswood, who talks about fostering and why men need to get involved. We've got paper subscriptions from £48 for 6 months or digital subscriptions from £3 a month. Just head on over to puremensmag.com, www.puremensmag.com, and get yourself a copy. These are made AI free by men for men.